advantage. Dr. Joe.
Thank you very much.
All right.
So let me get this straight. We are the only thing standing between you guys and some lunch, right? So we'll try and keep this snappy. Welcome to California. We're just up the road out of Los Angeles. For those of you guys who came in from Munich, thanks for bringing the weather with you. Though I have to say, it's actually been like this most of the year. If any of you are skiers, and I saw Michaela earlier was showing you how, what is that called again? That flyboard, right? Mammoth right now has got over 300 inches of snow. So that's like about 27 feet of snow, 9 meters for you Europeans. It's insane. I was there this weekend. If any of you want to go skiing or snowboarding, now is the time to do it. Anyway, today we're just going to talk to you guys a bit about, we all have one thing in common. You may not want to go skiing with me, but we are all people. And people are what makes up a company and what makes a company successful. Somebody might, look at the assets of a business, and they might look at the building or the patents, the trademarks, the technology. All of that is replaceable. At the end of the day, it's the people that you have in a company is going to determine whether that company is successful or not. And then when you look at your talent engagement programs, your talent acquisition and retention programs, you're doing one of the most important jobs in the company. The very first part of talent acquisition is an opportunity for branding. It may often be the first time people even see your company. Super important. And then the very people that you recruit and retain will directly determine the success or otherwise of your business, right? Let's face it, we've all got competitors. So this is big work we're doing. Now, I agree with Caitlin from Coca-Cola. It's not all about the technology. We have a technology platform with AtlasJobs, but on its own, technology is nothing. It's about the people that are using it. So today, I'm thrilled to have Carmen with us, who's a real-life customer and a user of AtlasJobs, and Carmen is with a company called PAM Health.
Hi, everyone. My name is Carmen Pavoda. I am VP of Talent Engagement for PAM Health. A little bit about our company is we are a 70 hospital system throughout the whole entire United States. We have a makeup of long-term acute care hospitals along with acute rehabilitation hospitals. We also have 30 plus outpatient clinics, whether it's therapy or it's wound care. We also just opened our first behavioral health hospital a couple of months ago, so that's been very interesting. Lots of new growth going on within our system. We have several new builds happening this year, whether it's acute rehabilitation hospitals or more behavioral health hospitals, but we have lots of things going on. A little bit of stats about our recruiting and kind of where we're at with PAM Health. In 2022, we recruited and hired 7,500 employees. From that, 1,500 were RNs. And as far as this year goes, we have already hired 2,000 employees, and 400 of those are RNs. At any given time, we have 2,500 open positions, whether it's full-time PRN, but certainly have a pretty big footprint when it comes to open positions, as a lot of people do in healthcare.
So the pain is real. I know some of you earlier, when statistics were going up, you were like, snap, snap, snap. So now's the time to snap, right? There was a survey by the Manpower Research Group last year. It came out towards the end of 22. And we are at a 16-year high in terms of difficulty of hiring, with 75% of companies reporting challenges in hiring. Now, you see the press headlines. Microsoft lays off 10,000 people. The bit they didn't mention was that Microsoft actually hired 40,000 last year, right? So, I think this demand for talent is not going away anytime soon. You may also know that we're hiring more and more of Gen Z. Over the next decade, it's going to become the most important segment of the population that you're hiring. And I've got a couple of these Gen Zs in my house, and they're not going to LinkedIn. They're not going to your website. They're on social media. And I think the average is 4 hours a day, though I tell you, it seems a lot more in my household, but The average is 4 hours of social media use a day. They are heavily influenced by what they're seeing on social media. I also saw a stunning statistic came out of another group last year, and I can give you the references if you need them afterwards. The average online job application takes 51 clicks to get through. You look at Gen Z, right? This is, can you see them doing that? Right? This is the most technologically advanced generation we've ever seen. It's also the most diverse generation we've ever seen, and we are saddling them with this ancient approach. So back over to you, Carmen.
Thank you. So with that being said, and as she said earlier, all of our applicants and our employees have choices wherever they go. In healthcare, it's very competitive, especially if you're a nurse. You have lots of choices, and it's a very competitive market. So what we recognized is, like Joe had said, whoops.
It's just going.
Like Joe had said, branding is very important, and so is social media. And that's where AtlasJobs was able to help us with their platform, because we recognized we were lacking in that area as a system. There were lots of times that we would go in and no one in the community really knew necessarily who we were. So we really were working on our branding piece, and the piece of their platform that makes it so nice is they actually allow us to do the day in a life videos where none of our other platforms allow us to do that. We're actually able to embed a video, a testimonial from a nurse or from a therapist of why they work at PAM Health, what their day looks like. And I mean, I'm a nurse by trade, and I get on TikTok and I'm like, oh my gosh, I'd like to go work there. Those nurses give their testimonies of why they are working where they are. So it's just that personal touch that we've never been able to do before. They've also allowed us to really get our brand out there. Their landing page is so interactive. It definitely appeals, and it's very relevant to what we had prior. We currently use an ATS, and we always had that on our careers page. We have moved their landing page to our careers page because it was so interactive. It had a map that tells about the hospital, the location, gives some information. So that piece was really, really important. There we go.
There we go.
All right, so the other piece of that is everybody's applying now on their mobile phones, right? Our stats show with PAM Health, 60% of our applicants come by mobile phone. So we have a large amount of people do apply that way. So this application needed to be user friendly, which it is. It's very interactive, it's appealing, it's relevant, and it takes 5 clicks, and they have applied. We all know, as she said, they're not going to take 51 clicks to apply. You'll stop midway through and you'll lose that applicant. So by having those 5 clicks, we're able to capitalize on getting more applicants. So our immediate observations, and before I go into the actual stats of what we've seen over the past 4 months, I just wanted to give you guys what it was like from the user end from PAM Health as a customer, what experience we had with integration and also customization and customer service. So we met 5 months ago, maybe a little bit more, and she said, we're going to integrate with your ATS in 1 week. And we laughed. Well, not to her face at the time.
True, you didn't tell me.
But we laughed, and we laughed really, really hard because, I mean, any of you guys know about integration, it takes forever. Well, we started the process, and we were wrong, and they were right. They integrated us, all 2,500 jobs, in 1 week. So never seen that before with our ATS. I mean, we still at times have problems with Indeed, so with our ATS. So certainly this was something that we're not used to having. The other piece of that is the customization part. If any of you guys are familiar with your ATSs or even using other platforms, usually you get what you get, and then that's all you get, right? Well, with them, we came to the table and said, we would like to do this, the embedding of the testimonials, for example. And they were like, we're not sure, but we're gonna try to get to the yes. And we are at the yes now. And that's what the whole experience has been like, because in order for us to stay relevant, We have to be innovative, and we have to have a partner that's willing to get to the yes instead of the easy no. So that piece it's been so great to work with them because we always get to the yes. The last piece is customer service. You know, there has been a couple of hiccups along the way, very small, but within 15 minutes, we give them a call and they're already returning our call and fixing it, and they're communicating with us. That means more than anything. You know, we use some of our other platforms and 3 days later, they call us back. So, and I'm sure like everyone experiences that. Everyone's busy. So it truly has been a great experience from the customer. I know it's very subjective with the exception of the 1 week. But it truly, you know, it truly has been a great experience. Now to the stats. So prior to November, we normally had between 6,000 and 7,000 applicants per month across our hospital system. November, we had 12,000. So, you know, 1 month is not a trend. We all know that. But it's certainly, you know, we started looking at it. December, we had over 12,000. So we're starting to look at it a little bit more. January, and everyone knows December's slow because nobody's usually making job changes because of the holidays. January, over 12,000. February, over 12,000 applicants. And March, we're tracking for almost 13,000 applicants. So I truly believe, and the data does show, that because of our strategic social media presence now, along with using this platform that is so user-friendly for the applicant, we have really increased our applicant flow. And I believe in this product because it's there in the numbers. So we've had some really, really great experiences with them. Healthcare is really hard right now. We know the pandemic has changed. A lot of people are getting out of healthcare. I'm a nurse, and you know, a lot of people that are nurses aren't necessarily practicing as nurses anymore. So certainly appreciate the platform. It's been helpful with recruiting.
All right. Thanks, Carmen. And honestly, I didn't pay her a thing for any of that.
She did it, I promise. It's unsolicited.
You're a great sister. So this is you know, basically a glimpse of the PAM Health system over here. The first week we worked with them, loaded up the jobs, and made the system usable. So we have tools that we can actually import the jobs from the ATS before we actually integrate. They started using the system in the second week, and candidates started showing up. We have a heat map, which we'll show you a little bit later, that shows where and when the candidates are coming in from. And I think this is very important. Wagner talked a bit earlier about system insights, and this really allows you to understand where you're drawing candidates from. Week 3, we did the integration with UKG, UltiPro, isn't it, the UltiPro system?
Chronos, yeah, right.
And
UltiPro.
that took a week, and then user acceptance. We developed some UAT scripts, did the testing. That was all looking great. Then we hit the great holidays, right? So then we hit Thanksgiving, and so the system's up and running at this point. We hit Thanksgiving, then Christmas, New Year, and then recently we just started programmatic marketing, and we're going to talk a little bit about what that is. So we've got an AI component of our system. We're going to use AI for good. And this AI engine really allows us to do, I think, some really, really smart stuff, particularly in the world of talent. Can you move me on one?
Sure.
So just take a look at it here. I'm going to try and explain it quickly. You create an advert that is, you know, sized and appropriate for social media that puts out your message. Now, within our system, you get the idea. There's a map, and you can see the jobs on the map. But the thing was, when we started working with PAM Health, they were really, really concerned about nursing positions, and particularly nursing positions in Sarasota, Florida, and in New Orleans. So it was like, can we really focus on those areas? So what we do is we create a segment. So if there's 10,000 jobs on the map or whatever, you can create a segment, which is like a mini map, if you think of it, which maybe has 200 jobs, but they're all nursing. So it's highly targeted. So now we've targeted our jobs and got them together. Now we're going to target the audience. So what we can do in Sarasota, Florida, we found this number of different nursing schools. That's a really good target audience for PAM Health. Also, as my CMO says, I like to use this expression, we've all spread our own digital dust everywhere. So people have identified themselves as being nurses. So what our tool does is it can go out and find and deliver these adverts directly to the people who are the most likely to be the valid candidates. So it's two-ended targeting from the technology perspective in terms of pulling the relevant data and content and jobs together, and then targeting from the prospective audience. Those of you guys who like a little bit of audience participation, if you hit that QR code on the screen with your phone,
I think on the table also.
There's also one on the table. I don't have my phone. If you hit that with your phone, it should actually take you to the nursing segment that's currently running for PAM Health. And you'll be able to see the jobs, hopefully, on the map. You can move around the map and see the different jobs in the different areas, click through, look at the content, and so on, just to give you an idea what it looks like. Okay, so let's talk a bit about the results. And for that, I'm going to ask our head of marketing to take over. Have I turned that off? Try it.
Am I good? Can you guys hear me? Yeah. Okay, great. Hello, everybody. So I'm just going to step in here for a couple of slides and talk about marketing. So what we tried to do for PAM Health was really amplify their employer brand, right? We understood the challenge. We understood that they really needed to bring in and engage with registered nurses, RNs, and that in particular there were some geographic targets that were a particular challenge for them. So on the marketing side, what we did is, as Joe just explained, we used our programmatic platform. We created a campaign, and we got the message out to the right audience, right? And I just want to say it's active audience and passive audience, right? So the digital dust is, people who are out there actively searching for, I'm looking for a nursing job in Sarasota, Florida, or, find nursing jobs. We're able to kind of key into that behavior and make sure that those folks were seeing our marketing messages as well. But then there's that passive audience, all those individuals who may not be actively looking for a nursing job or ready to make a change. We wanted to make sure that our marketing and our employer branding was getting in front of them as well. So great, that's super cool, does it work? So what we did was we drove all of that traffic to a segmented map landing page that specifically just shared those nursing positions. So rather than drive them to a location where, they have to sort through all the jobs and, figure out what they need to look at and all that, we are immediately taking them into an experience where it's like, we said we had nursing jobs, we're delivering nursing jobs. And the experience is what's important, because we all know how hard it is to engage, how hard it is to find this talent and these candidates. So we want to make sure that, even if the marketing's great, you guys, we've all been there, right? Even as consumers, we click on something, we engage with an ad or an invitation in some way, and we end up at this horrible place, whether that be, a landing page, or it could be a career listing, an ATS or whatever, that's just not really optimized. So in this case, what we did was we sent them to this really engaging, great experience. And what we saw is, here's some stats on the screen here for you. We served 1.5 million impressions, but we were able to get 8,500 engagements. Like, that's amazing, from a digital audience. Again, very specific digital audience. And how do we know that that's different? Because during the same period of time, we were sort of managing what was going on, organically, right, on the PAM Health side. So 12 times engagement versus just traditional channels and other things going on. So next slide. So quality is great. Quantity is great, but we want quality, right? So we also took a look at that and said, okay, well, of these people who are engaging through this channel, how are they engaging with the content? And what we saw was these folks going through this experience were spending more time with the content. They were spending more time looking at jobs. And that's really what it's all about, and what we're trying to do is create this great experience. Now, from these experiences, they go on through to engage directly with PAM Health, right? But now we've set that employer brand up to be a super, super positive experience with this engagement. And next. So just another little quick statistic about, does it work in terms of targeting the right audience? So what you're seeing on this pie chart here is where did the candidates come from during this program? So obviously New York and California always pop, they're very, very large. But what you can see on this chart is Pennsylvania, Louisiana, and Florida in particular, Texas as well, were very specific. That's where our marketing programs were focused, because those were the areas where we were really trying to bring in and engage talent. So again, I think the statistics show, we were able to bring in the volume. We were able to engage them and get them to interact longer with the brand. And we were certainly able to move the needle in the areas of the country that were really important to PAM Health. What's next?
Thanks, CW. Is that? You guys hear me? That's good. Thank you. So I just wanted to talk a moment on the data and how important the data is. So as we're running these programs and running these campaigns, we are tracking every single signal that we're getting. The engine, the AI engine, if we went out to, say, 2 different nursing schools and we got 100 candidates from one and 1 candidate from another, the AI engine learns that that is not a good source for those kind of candidates, whereas this one is. So the whole time, things are improving. Within our technology, we have the ability to really show people where the candidates are coming in from. And I think this really helps people. It also helps with the DEI lens. If you're looking at this and trying to figure out how to diversify, and you're getting only a certain demographic coming in for interviews, this will allow you to look to see, well, actually, if we shifted our marketing and maybe moved more into this area, we could actually attract a more diverse group of people. So a lot of good information there. I'm going to hand this to you in a second. So what's next? I guess what's next with PAM Health? One of the things that we are looking at implementing right now is career pathways. I think one of the things that you can see, when you get a candidate and they become an employee, it's something like it's almost 70% of employees feel they have to go to another job in order to advance their career. 60, actually. Was 60%, oh yeah, you're right, 60, thanks. I think we got that wrong, because I think the 60% is the percentage of employees who have no idea of the career opportunities at their current company. So one of the things that we're seeing is some of our customers are using our technology as an internal mobility tool, because the employees should get this great benefit as well. So now the employees can see the various options that are out there. Somebody mentioned tagging earlier. I cannot remember whether that was this. That was you. The tagging idea, super important, right? So, I think particularly you might apply for a position and you're either slightly too late, they just filled it. One of our clients tends to fill jobs in about a 3-day cycle, so they get candidates coming in days 4, 5, and 6 that are still very valid. So you can, in the system, very simply set up and say, yeah, I'd like to be notified if another position like this comes available. So both employees and candidates can tag themselves with that. And then there's the career pathway. I'm working at a company. Where's it going to lead? Back in the old days, people would go to DuPont and you'd be the CFO of DuPont for 20 years. You'd stay there, work through your career, and that would be your job. Now, I'm sure you guys you're obviously looking at resumes all the time. Over a year is kind of commendable. There's very, very fast jumps going on. And I think a lot of it is because not knowing what their opportunity is with the current company. So I think the career pathways is a big thing. We've seen some legislation in the US. Europe was way ahead of us with this. It started with Colorado here. California is one of the latest. When you display a job, you have to put the salary, right? So you're starting to get the salary transparency. We also believe, and some of our bigger clients are very much focused on this, and PAM is about to focus on this, is the career transparency. What's my pathway look like in this company? And Carmen, do you want to?
And that's really important, especially for retention and for growth and development also. I mean, I am a product of that. I've been with the company for 19 years. I started out as a nurse on the floor. And then I was like a charge nurse and a nurse manager, then a CNO, then I was a corporate director. And then I was a VP of clinical, and just recently I moved over to talent engagement, which is kind of, I don't know how I ended up there because I've never been in HR, but I love it. So, I mean, that's just a product of, our CEO and owner of our company. He feels there's a lot of value with his staff. He has a lot of trust, and he wants to reward his staff. So these career pathways are really important. We've got, executive programs that we're helping our current employees get through so they can become CEOs, CNOs, things like that. So they have a pathway so they don't want to leave.
And you don't even know about this one. There's top secret plans. So, I just wanted so this is a shock. But we're working with some of our clients on this idea, which I think is going to make sense. So everything I've shown you today is out there right now. If you come by booth 7, we can show it any of it to you. It's in live use in very large companies. This isn't. So what we're looking at here is an approach where whenever somebody applies for a job, we've got that record. We've captured the record. So we can turn the map around. And instead of it being jobs, internships, apprenticeships, or whatever, it can now be candidates, prospective candidates. Those candidates can be in your company, or they can be people who applied that didn't get a job. Or maybe they took a job and then I think somebody called that the boomerang. I wasn't familiar with that, but I think that's what you guys were referring to. They go and then they come back. This can help you bring them back. So people who applied and for some reason weren't successful, you can now mine that data and be able to see, well, they weren't right for this job, but this job over here, they actually would be really good for. Or maybe if we gave them this boot camp, this 6-week boot camp, they would now be valid for these positions. So it really allows, it's a tool that we believe is going to really allow career development departments in companies to get in there and really kind of go on the offensive around talent.
It's going to be amazing.
So I know everyone's starving. I'm happy to take questions at the booth later, unless you guys particularly want to, if you want to open the floor, but up to you guys. If you want to hold it?
All right, round of applause. Thank you, guys. So a couple